Malaria, Prevention and Prophylaxis by Doctors Frans Cronje, Albie de Frey and Hermie Brits. Malaria is a perennial concern to travellers in Africa. Of all the questions Dan receives, malarial prophylaxis is one of the most common. Safety of medication whilst diving and drug resistance considerations are usually the most pressing issues. As divers venture deeper into the African continent and in Asia, the risks of contracting malaria increase proportionally. Lack of medical facilities and transportation and communication difficulties add additional complexity to managing a medical emergency such as malaria. And for this reason, understanding malaria prophylaxis as well as general preventative measures is of the utmost importance. This presentation covers some of the basic principles and the most important consideration in selecting and using malaria prophylaxis measures and medications. The medical treatment of malaria, which is complex and requires close medical supervision, falls outside the scope of this article. If you think you may have malaria, or you're concerned about unexplained symptoms after visiting a malaria area, contact Dan immediately. Our hotline number is 0800 020 111. The three most important guidelines regarding malaria prevention and survival are 1. Don't get bitten, 2. Seek immediate medical attention if you suspect malaria, and 3. Take the pill or anti-malaria tablets and prophylaxis. Firstly, don't get bitten. To do this, it's best to stay indoors from dusk to dawn. If you have to be outside between dusk and dawn, cover up with long sleeves, trousers, socks and shoes. 90% of mosquito bites actually occur below the knee. Apply DEET containing insect repellent to all the exposed area of skin and repeat this every 4 hours. Sleep in mosquito-proof accommodation, air-conditioned and or proper mosquito gauze. Buildings and tents should be regularly treated with pyrethrum-based insect repellent and insecticides. Burn mosquito coils and mats to discourage the entry by mosquitoes. Sleep under an insecticide-impregnated, that is, permacoat or peripel mosquito net, which is very effective. Secondly, seek immediate medical attention if you suspect malaria. Any flu-like illness starting 7 days or more after entering a malaria endemic area is malaria until proven otherwise. The diagnosis is made on a blood smear or a rapid malaria antigen finger prick test. Note, though, that one negative smear or rapid test does not exclude the diagnosis. Repeat the smear or rapid test until the diagnosis is confirmed or another illness has conclusively been diagnosed or there is a spontaneous recovery from ordinary flu, for instance. 3. Take the pill. There are several dangerous myths regarding malaria prophylaxis that need to be set right. Prophylaxis does not make the diagnosis of malaria more difficult, and it does protect against the development of cerebral malaria. Prophylaxis is not 100% effective, hence the importance of avoiding bites. Not all anti-malaria medication is compatible with diving, and malaria is often fatal, making the prophylaxis justified. Now, anti-malaria drugs, like all drugs, have potential side effects. The majority of these side effects decrease with time. Serious side effects are rare and can be avoided by careful selection of a tablet or combination of tablets that suit the requirements, country, region or season. The following drugs are available for the prevention of malaria. Firstly, doxycycline, of which the trade names may include Vibromycin, Cyclidox or Dorix. These are used extensively in the prevention of chloroquine-resistant malaria and are about 99% effective. They're not officially recommended for use in excess of 8 weeks for malaria prevention, but it has been used for as long as 3 years with no reported adverse effects. It also offers simultaneous protection against tick bite fever. The dosage is 100 milligrams daily after a meal, starting 1 or 2 days before exposure until 4 weeks after the exposure has ended. Doxycycline should be taken with plenty of non-alcoholic liquid. It's contraindicated in pregnancy, breastfeeding, and children below the age of 8 years. The side effects may include nausea, vomiting, diarrhea, allergy, and photosensitization. It may cause vaginal thrush or candida and may reduce the effectiveness of oral contraceptives. Its use in pregnancy is considered unsafe, as in fact is scuba diving also. Doxycycline is Dan Southern Africa's agent of choice for divers diving in sub-Saharan Africa as well as in other areas with chloroquine resistance or chloroquine-resistant malaria. 2. Chloroquine. Trade named Nivaquine, Daramil or Plasmaquine. These products only contain chloroquine and must be taken in combination with proguanil or paludrine. The dosage is 2 tablets per week, starting 1 week before exposure until 4 weeks after leaving the malaria endemic area. The contraindications include known allergy and epilepsy. Side effects may also include headache, nausea, vomiting, diarrhea and rashes, and it may also precipitate photosensitivity or sunburn, which can be prevented by applying sunblock. It's considered safe in pregnancy, although diving is not. Proguanil or paludrine. This must be taken in combination with chloroquine. The dosage is 2 tablets every day, starting 1 week prior to exposure until 4 weeks afterwards. The contraindications are known allergy to proguanil, and there are potential interactions with warfarin, an anticoagulant or blood-thinning agent that is generally considered incompatible with diving. The side effects may include heartburn, which may be avoided by taking it with a meal, with a glass of water, and not lying down shortly after taking it. It may cause mouth ulcers that can be avoided by taking folic acid tablets 5 milligrams per day. It may cause loose stools that are generally self-limiting and do not require specific treatment. It is considered safe in pregnancy, but must be taken with a folic acid supplement of 5 milligrams per day. Note again that scuba diving is not considered safe during pregnancy. The combination of chloroquine and proguanil is about 65% effective for resistant falciparum malaria. It's not the first choice, but its relative safety and limited side effect may justify its use in certain individuals. 4. Atovaquone proguanil in combination, trade named Malarone and Malinol. This drug was registered in South Africa as a causal prophylaxis in February 2004. Safety in diving has not been confirmed conclusively, but many divers have used it since with no adverse effects. It should obviously be used with caution. Additional sensitivity to motion sickness has been reported anecdotally. Preliminary data suggests it is safe for pilots. It is effective against malaria isolates that are resistant to other drugs, and controlled studies have shown a 98% overall effectiveness of atovaquone proguanil in the prevention of falciparum malaria. The dosage is 1 tablet daily for adults starting 1 to 2 days prior to arrival in the endemic area, continued during the exposure, and then for 7 days after leaving the endemic area. The dose should be taken at the same time each day with food or a milky drink. Contraindications include known allergy to proguanil and atovaquone or kidney problems, such as significant renal disease, which is likely to be incompatible with diving anyway. Safety in children below 11 kilograms has not been established. The most common side effect is heartburn, and again, this may be avoided by taking it with a glass of water and not lying down shortly after taking it. Mouth ulcers may occur and may be treated with folic acid. To date, atovaquone has been well tolerated, with most common adverse reactions being headaches. Safety in pregnancy and breastfeeding has not been established. Again, diving whilst being pregnant is not recommended. 5. Mefloquine, otherwise trade named Lariam or Meflium. It is about 90% effective against chloroquine-resistant malaria. It is convenient in terms of its dosing schedule in that it only requires 1 tablet a week. The side effects include drowsiness, vertigo, joint aches, as well as interference with fine motor coordination, sometimes making it difficult to exclude decompression illness as a possible alternative diagnosis. It also causes strange and potential psychiatric symptoms. It is probably safe in early pregnancy and may be used with confidence after the first trimester of pregnancy. It may also be used in breastfeeding and babies weighing more than 5 kilograms. It is, however, considered unsafe for divers and pilots. It is contraindicated in epilepsy, but is a good first choice for other travelers. The medication has a long half-life, which means if side effects appear after taking an initial treatment, they may actually preclude diving. They may also develop after the accumulation of several weeks of treatment, again resulting in a long term of side effect-based contraindication to diving. If someone has used Mefloquine confidently in other situations, or is on Mefloquine when diving fitness is considered, then it is probable that it would be safe for that individual. Nevertheless, Mefloquine is not recommended with diving. 6. Pyrimethamine dapsone, marketed as Maloprim or Deltaprim Malazone. It is no longer regarded as effective. 7. Sulfadoxine and pyrimethamine, or Fansidar, again, no longer used as a prophylactic. It may be appropriate in treatment under medical supervision. 8. Quinine. This is not used in the prophylaxis, but is the backbone in the treatment of moderate and severe malaria. Serious side effects are not uncommon during treatment, thus making it incompatible with diving. Artemether, or Cotexin. This Chinese drug is available in some areas of Africa, and again it is not used for prophylaxis of malaria. It is used in combination with other drugs in the treatment of mild to moderate malaria. Halofantrine or Halfan, not used in prophylaxis and best avoided for treatment of malaria. Please visit the DAN website for more information about the distribution of malaria to assist your choice. Again, the first choice is doxycycline. In summary, prophylaxis significantly reduces the incidence of malaria and slows the onset of serious symptoms of malaria. All antimalarial drugs, excluding Mefloquine, are considered compatible with diving. Like with all other medication, anti-malaria drugs should be tried and tested on land well in advance. If there are unpleasant side effects, please consult your doctor or call Dan. Whether or not you take prophylaxis, be vigilant about the potential for malaria symptoms. Malaria presents itself in many ways, varying from fever to diarrhea to flu-like symptoms. Always inform your doctor that you've been in a malaria area. Symptoms can start within 7 to 14 days from the first exposure, and as long as 30 days, even months, after leaving a malaria area. No single medication is 100% effective, so barrier mechanisms and personal protection against bites are essential. These include mosquito repellents, nets, protective clothing, and not going outdoors from dusk to dawn. Any strange symptom occurring during or within 6 weeks of leaving a malaria area should be considered with suspicion, and it requires medical attention. For more specific recommendations on malaria drug prophylaxis in the DAN Southern Africa region, including Africa and the Indian Ocean Islands, visit our DAN website on www.dansa.org.